Action.
Erectile dysfunction and international prostatic symptom score correlation in men with lower urinary tract disorder. Our hypothesis is to establish a direct correlation between the international prostatic symptom score and erectile dysfunction of patients with benign prostatic hyperplasia. Material and method. This is a cross-sectional study described data from patients with benign prostatic hyperplasia. The sample was non-published, exhaustive, and of convenience, taken in sample way with consecutive recruitment. We have a sample of 30 patients with benign prostatic hyperplasia who met the criteria inclusion. The first part of the questionnaire that we used made it possible to collect information of the socio-demographic and clinical characteristics of the patient. The second part of the questionnaire made it possible to identify the elements related to the International Index of Erectile Function 5 score and the International Prostatic Symptom score. Quality of life assessment related to urinary symptoms was very satisfied for 0, satisfied 1, rather satisfied 2, sharing 3, rather bored 4, bored 5, and very bored 6. For statistical analysis, after encoding and validation of the data, they were entered on the computer using Microsoft Excel 2013. The database being formatted, the analysis were carried out with iPSS 22 software. The statistics used to describe the variable were the mean, standard deviation, and extreme for quantitative variable. Qualitative variables have been described as relative percentage and or absolute frequency. The Q-score test was applied to compare the proportion, the correlation between the International Prostatic Symptom Score and that of International Index of Erectile Function 5 was established using simple linear regression with calculation of correlation coefficient R, and finally to estimate the degree of correlation. The p-value of less than 0.05 was the threshold for statistical significance. The data often were illustrated in the form of table or figure. The mean age of the patient was 69 years, with range 51 to 84 years. The majority of patients were between 65 and 70 years of age in a proportion of 37%, followed by those in the age group under 55, 65, 26%. And the most frequent reason for consultation were glyceria, 55%, regulation, 51%, and urinary retention in 48%. The median PDCA was 5.59 nanogram by deciliter, with range 1.14 to 24.9 nanogram by deciliter. The majority of patients had a PSA level between 4 and 10. Urine analysis was pathological in 11% of patients. The median prostate volume on ultrasound was 130 grams, with range 39 to 208 grams. The majority of patients had a prostate volume greater than 60 grams, 72%. After evaluation, 46% of patients had severe prostatic symptoms, 14%